guys, welcome back to my brown physio. I'm Dr. Neha Singh, and today in this video we're gonna study about dislocation of acromial joint. Acromial joint is a diarthrodial joint with a fibrocartilaginous disc between the two bones. The mechanism of injury is direct force due to road traffic accident, indirect force due to fall on outstretched hand, and downward indirect force through the upper extremity, which is very rare. Now grades of ACI, which we'll see in another page. First, let's see the clinical feature, that is pain, swelling, difficulty in raising arm up, tenderness, lateral end of clavicle is prominently felt. Then step deformity. For investigation, X-ray should be done in anterior and posterior view. They can be subluxation or dislocation can be seen in the X-ray. For treatment, we gonna see both conservative and the surgical management. For conservative, rest, icing should be done. Then sling, strapping, cast or harness to be put on for 10 to 14 days or up to 3 weeks. Now for surgical management, AC repair, CC repair or excision of distal end of clavicle for all symptomatic cases. Dynamic muscle transfer by transferring coracoid process. ORIF is done using the plates and PHYSIO. Now what all the complications can arise? Associated clavicle fracture, coracoclavicular ossification, osteolysis of distal clavicle, complication after surgery like infection and joint stiffness. Now coming to the physiotherapy management, our rehabilitation goals should be pain relief, restore back shoulder movement to gain functional range, to restore normal muscle strength. Now seeing the conservative treatment, both immobilization and the mobilization phase. So for immobilization, it is done up to 3 weeks. No shoulder range of motion should be done. Full active range of motion of elbow, forearm, wrist and finger should be there. Strapping sling up to 3 weeks, inspected for slackness and tightened accordingly. Now coming to the mobilization phase, which is from 3 to 6 weeks. Pendulum swinging exercise, passive mobilization, patient in supine, passive elevation, then horizontal abduction and adduction should be done. Those movements put stretch on acromial joint. Sling discarded gradually. Active assisted movement greater than 90 degree to be achieved at earliest. As acromial joint plays a vital role in abduction elevation beyond 135 degree, heating therapy for pain relief. Then in 6 to 8 weeks of mobilization phase, self-resistive home exercise is prescribed, and then to regain full active shoulder range of motion. In case of surgical treatment, in this case, ORIF and ligamentous repair physiotherapy treatment differs. Shoulder mobilization start after 4 weeks. Heat therapy for pain relief during mobilization. Self-resistive exercise, horizontal abduction adduction helps in the strengthening repaired ligament. Normal function and full shoulder active range of motion is regained after 8 to 10 weeks, unlike conservative management. Now grades of acromial joint. You have to remember this, as sometimes in exam they do ask what are the grades of acromial joint injury. Grade 1, that is minimal strain at joint. Grade 2, rupture of acromial joint ligament and joint capsule. Grade 3, rupture of ACL and CCL, that is acromioclavicular ligament or costoclavicular ligament. Physiotherapy management according to these grades. Grade 1, in first to 2 weeks, pain, icing for 15 to 20 minutes is done. Then TENS or IFT can be also used. For swelling, ultrasound is used. Then for immobilization with triangular sling up to 2 weeks, active range of motion of finger, wrist, forearm, then isometric of elbow, shoulder, deltoid, as we saw when we were studying for the in general physiotherapy management for acromial injury. Now after second week, maintain range of motion with active assisted exercise. Make sure prognosis doesn't worsen. Plan for strengthening exercise after achieving full range of motion. Deltoid strengthening maximum up to 90 degree. Then full flexion of shoulder. Example, in sports person, throwing ball activity with gradual increase in weight. In grade 2 injury, same protocol as grade 1, but swelling will be more compared to grade 1. Pain also present. Icing and Faraday current should be used. In grade 3, surgery is needed. Pre-operative can only manage for pain and swelling. Post-operative, as previous page, surgical and conservative treatment protocol should be followed. That's it for this video. I hope you like this video and this might help you. I will see you in my next video. Till then, bye bye. See you.